Thanks so much, Christy. So this week, we're pretty much holding at a steady state with respect to our COVID-19 activity. Um, we have had just over 500 new cases reported, but as we know, this is just the tip of the iceberg because a lot of people are testing at home and that doesn't get reported to us. We also look at our other data. We look at our syndromic surveillance, we look at our wastewater surveillance, we look at hospitalizations, and all of those indicators are fairly steady as well, decreasing a little bit. So if we look at our total hospitalizations, we're now down under 20 total hospitalizations. We're at 18 hospitalizations, 16 of which are new hospitalizations. So this is a slight downward trend, but I would say overall, we've sort of plateaued a little bit, and hopefully we'll continue to see more significant decreases in the future. The other big news with respect to COVID-19, of course, is that we now have vaccine available for our 6-month-old to 5-year-old population, under 5 population. So that's great news for those parents who are interested in getting their children vaccinated. And Christy can provide more specific details about vaccine in the Q&A period. So that's really our COVID-19 update. Again, we're holding at a fairly steady state with respect to COVID-19 activity, with slight decreases in our syndromic surveillance as well as in our hospitalization. So hopefully that's all good news. And we look forward to being able to provide parents of our younger children vaccine for those who are interested. With respect to our hepatitis A situation, we unfortunately continue to see cases of hepatitis A. For this calendar year, since January, we're now at 66 cases, including 50 hospitalizations. And so really, this is a short briefing. I'll open it up to questions and answers. Okay, so the question was about shots for children. Is there one that's recommended over the other? What is the difference, the biggest difference between the two? So with respect to the vaccine for children, it really is going to be parent preference. Just as we had with adults, we have Pfizer and Moderna. The Pfizer is a 3-dose series, Moderna is a 2-dose series. And really, I would say that from what we've heard of providers tend to be heading more towards the Pfizer. We have ordered both Moderna and Pfizer at our clinics, and we've seen about equal uptake in both of those vaccines. So if parents have questions, I think particularly because we're talking about young children, I think it's really important for them to talk to their healthcare professionals about what may be the best vaccine for their child. For us as a public health agency, we're excited to have 2 safe, effective alternatives for our children. I don't see that there's any significant difference between the 2 at all. I think it's really going to boil down to parent preference. So I hope that answers your question, Jacob. So the next question from Jean is there anything in particular about medical history that would make someone more apt to get COVID? I'm not sure if that's specifically talking about the children 6 months to 5. I think with children, we always, again, I want to reiterate, the FDA and the CDC have now both approved this, as has VDH. These are safe, effective vaccines, and we would encourage any parent who wants to have their children have that protection against COVID-19 to get their child vaccinated, but it is a parental decision. We certainly, so in terms of medical conditions, I think that is something that each parent is going to have to decide with, or each care provider, because there might be a custodial parent, will have to decide with their healthcare professional. And we know we are definitely providing vaccine here at our health departments. And again, Christy can provide us more specific details about that. But we know that quite a few parents are going to prefer to get their child vaccinated at their healthcare professional's office, at their doctor's office. And that's really a discussion in terms of medical conditions that needs to be had with your healthcare professional. I think that those of us in public, many of us, not all of us, but certainly as a public health professional, I would encourage parents to get their children vaccinated, because while children don't have the same from a population perspective, children do not get as sick as adults. There's no question about that. We know that this virus is not as dangerous for children. We still have had a lot of children hospitalized. We still have had pediatric deaths, and we still have children who have long-term sequelae because of COVID. So, I think that this is a decision that each parent is going to have to make for their child. But certainly a child who has an underlying medical condition that puts them at higher risk for poor outcome for COVID-19, we would encourage them to get vaccinated. So where can people get it? So the vaccine is here. People can talk to their primary care providers, their pediatric providers, to see if they have it. We know the vaccine was pre-ordered, so we know that there are providers in our community who do have vaccine on hand. They can talk to their local health department. The FQHC, the federally qualified health centers, have vaccines. So in our community, New Horizons, and certainly pharmacies. You should contact your pharmacies. Pharmacies can vaccinate children 3 and up. So those there are many different options for parents, and they should choose the option that is best for them. What would I say to parents who might be hesitant about the vaccine or who want to wait and see? I really think that this is a situation that our goal in public health is to make sure that people have the right information to make the right decision for their family. And that's going to differ from family to family. So I think that if there are families who are hesitant and want to wait and see, I would strongly encourage them to talk to their healthcare professional, to their nurse practitioner, to their physician, and figure out what their concerns are and see if their healthcare provider can address those concerns. And certainly people can call us if they have questions. We can't give specific advice to individuals, so we can't say for this child we would recommend this, but we certainly can say as a general recommendation, these are safe, effective vaccines. We encourage parents of children 6 months to 5 years to get their children vaccinated, but we recognize that not all parents are going to feel comfortable. Some are going to wait and see, and we respect that. Will there be vaccine clinics like there have been for other groups? Where can parents go to get? Hopefully I've answered where parents can go. We aren't having specific mass events, primarily because the numbers are really small. We are going to be offering vaccine at all of our clinics, in all of our jurisdictions. And as our vaccine clinics fill up, we'll open up more spots. So given the small size of the population that's 6 months to 5, and given the information that there are a lot of parents who may choose to wait or who may choose not to get their children vaccinated at this point, it didn't seem prudent to offer mass vaccine clinics. We also know that a lot of parents are going to want to have their children vaccinated at their doctor's office. Yeah, so the question is, how are these vaccines different from adult vaccines? As with the 5 to 11, they are different dosing. And so, they're real specific information, but the bottom line, it's the same basic vaccine, but it's different dosages. We do expect the same side effect profile. There are no significant concerns with respect to COVID-19 vaccines and children. And we know that the FDA took a long time looking at all of the data. It took us a couple more months than we initially expected because they did their due diligence. And then the Centers for Disease Control reviewed all of that through the Advisory Committee on Immunization Practices, and then VDH. So we know that it's gone through several layers of vetting, and we know that these are safe and effective vaccines that do not have a significant side effect profile. I think I've answered all of the questions in the chat. Are there other questions? And just to reiterate, the common side effects are going to be arm soreness, little irritation at the site of the injection, as we would see with adults. Are there any other questions?
Well, just for your information, there's been a lot of interest in the Moderna vaccine. And so the clinic that we have in Roanoke for Thursday offering the Moderna vaccine is already full. There's still openings for Pfizer. By the time you have evening airtime or go to press tomorrow, that may no longer be the case. But as Dr. Morrow said, we're opening up clinics going forward. So we also have clinics in Covington this week, and then next week we'll be rolling out vaccine in our other local health department locations such as Vinton and Fincastle. They'll be able to make appointments. The way that people should reach out is to call the local health department. We have put all of the phone numbers on our website. I'm happy to post that here if that would be helpful. Or I can send, actually, why don't I send that out with the data update? Dr. Moore, were you going to give us a date such as it is, or are you still waiting?
No, I think our data is now all set, so we should be able to send that out shortly
Okay.
after this.
Okay.
We have, so our hospitalization data and our total counts are in for this week, so we should be good with our data. And I think, you know, the other thing that I want to reiterate, Chris, you just mentioned that we have already filled our Moderna for this Thursday, but I think it is important for parents, if there is no urgency. I know that there are parents who are really anxious to get their little ones vaccinated, and we support them. We will be opening up vaccine clinics as we get more vaccine in. We're not worried about any shortages. So I would just say that if there is a parent who is concerned that they didn't get into the Thursday clinic, hold tight. There will be more vaccine opportunities opening up. And again, if your child's over the age of 3, you can contact a pharmacy. Contact your primary care provider, your pediatric provider, and see if they have vaccine, because we know that several of the pediatricians, the pediatric practices in our community have ordered vaccine.
Absolutely. And I think that some of the pediatricians' offices have instructed their frontline staff to hold off on announcing what the plans will be, but I think that that's coming very, very soon. And it could be that they're waiting for all of their shipments to come in, as we did before we announced our clinic links. They may be waiting for all of their shipments to come in before they start making appointments. So it could just be a matter of a day or two before they will open up.
Exactly.
All right, well, with that, I welcome you to reach back out to me if you have any follow-up questions. Otherwise, keep an eye out for the data, and I'll send you the link for those clinics if you want to share those with your audience. Thank you very much.
Thank you.
Take care.
Bye-bye.